Hello, my name is Patrick Brown, Mayor of Brampton, and I'm joined here today by Dr. Lawrence Lowe, our Medical Officer of Health for Peel Region, and Paul Morrison, our Director of Bylaw Enforcement. Today I'm pleased to share a number of updates about our COVID-19 efforts in Brampton and the region of Peel. First of all, I want to say that our 2 new isolation centres are officially open. So that's great news. I had argued and advocated before that we needed isolation centres to help with those that test positive, who live in crowded living conditions, and how COVID-19 can spread very fast in those environments. And so having these new isolation centres open is relief, because this is one of the tools we felt would be helpful in our battle against COVID-19. And I want to thank the provincial government for stepping up and providing that funding for those new isolation centres. And if anyone has a loved one who has tested positive or has been exposed or has COVID-like symptoms, you can call 905-281-1269 for more information. That's 905-281-1269 for more information on our isolation centres in Brampton. The second thing I want to mention today is about vaccine supply. Earlier this week, Mayor Crombie, Mayor Thompson, myself, and Peel Region Chair Yanika wrote the Premier about the equitable rollout of vaccines in the province. And I understand that the supply is set by the Government of Canada, but it's important that the supply that Ontario does get goes to the areas facing the toughest challenges with COVID-19, and there needs to be some relevancy in terms of the per capita rollout. And I would note, so far in the rollout, we've looked at regions like Ottawa receive more vaccines than Peel Region, and one of the challenges that this presents is, one, there's more people in Peel Region with almost 1.6 million individuals. There's more people in ICU, more people hospitalized, and a higher positivity rate. And so there's no basis in which you wouldn't see vaccines being rolled out at least proportionally in Peel Region than other parts of the province. And so we've written this letter to the Premier, and we hope that the initial numbers of the rollout of vaccines was about getting the system set up, and it certainly won't be a precedent going forward because there's no reason that one of the hardest hit parts of the province, frankly a part of the country, shouldn't have its fair share, equitable share of vaccines. I also wanted to speak to sick days. My colleagues with the GTHA mayors and the Ontario big city mayors continue to advocate for paid sick days. There is a significant gaps with the Canadian Recovery Sickness Benefit. It takes sometimes 3 to 4 months, and the benefit is less than minimum wage. And because of that, Canadians are not using the Canadian Recovery Sickness Benefit as a means of sick pay. And we have people going to work sick. We have people spreading COVID-19 because they can't afford to miss a paycheck. And there's people that struggle to put food on the table and pay their rent, and that basic mechanism needs to exist. We need paid sick days. We need the Premier and the Prime Minister to come to the table and make sure we find a solution for this challenge, and it can certainly be achieved through addressing the shortfalls in the Canadian Recovery Sickness Benefit, and I hope these conversations happen as soon as possible, because just like isolation centres, paid sick days is a tool that would help in the battle against COVID-19. I also wanted to mention what's happening with outdoor amenities in the city of Brampton. You know, I've had a number of people ask, other municipalities have closed skating rinks or tobogganing hills. What is Brampton going to be doing? Let me be very clear. We are not closing our skating rinks. We're not closing our tobogganing hills. Public health has said very clearly that these activities are low risk. I believe that getting exercise, getting fresh air is good for our city. I think it's good for mental health. And our Winter Wonderland plan, which we launched earlier this year, was supported by Peel Public Health. We are basing our decisions on what amenities to offer by working with public health, by looking at the science and the data. And I certainly believe that shutting down these amenities is an overreaction and not fair to our residents. They're already facing significant challenges because of the lockdowns. So we've actually opened 4 new outdoor artificial ice rinks in the city of Brampton to give our residents more opportunities for safe outdoor activities. And if you're interested in using one of our rinks or one of our outdoor amenities, you can always go to brampton.ca, Winter Wonderland, to see all the options that exist. And we're also increasing the maintenance of our trails for those that want to run or walk or bicycle. Getting fresh air is important. We know how hard it is right now, so please don't hesitate to use one of our winter amenities in a safe manner if you live in Brampton. For an Osler update, I wanted to share with you that there are currently 53 patients at Brampton Civic Hospital, and 14 of those patients are receiving care in the ICU. In terms of testing, Osler has performed 342,155 COVID-19 tests, and once again, Osler continues to be a leader in testing. And in terms of a bylaw update, between January 11th and January 17th, officers laid 5 charges under the mandatory face coverings bylaw, 10 charges under the Reopening of Ontario Act, and 3 charges under the Emergency Management and Civil Protection Act stay-at-home order. So on that note, it's my pleasure to invite to share with you an update Dr. Lawrence Lowe, our Medical Officer Health in Peel Region. Then after that, we're happy to take any questions you may have.
Thank you, Mr. Mayor, and good morning. Brampton's test positivity this week is at 15.2%, down from 17.4% last week, with a weekly incidence rate of 343.9 per 100,000 cases, which is flat from 350.8 per 100,000 cases last week. This next week is crucial in our battle against COVID-19, and we will finally see if the holiday surge is ending and if the measures in place will hopefully start to drive transmission down. I want to thank everyone for doing your part and staying home as much as possible, limiting your outings to the essential reasons with precautions: work, healthcare, medications, groceries, gas, and exercise on your own or those that you live with. Not attending or hosting social gatherings in person, postponing and meeting virtually instead. Your sacrifices are making a difference. You are saving lives. You are helping our hospitals continue their miraculous efforts to battle this disease, even as the situation there remains precarious. And you are also protecting our essential workers. Those for whom working at home is not an option, and those for whom self-isolating without pay represents a risk. For those workers, we also still need inspections, investigations, and protections. More support for our Ministry of Labour colleagues to blitz high-risk sectors, not just big box stores, and enforce and fine non-compliance. More rapid testing deployed in workplaces to quickly identify and stop spread. More workplaces removed from the essential list temporarily, with support given to businesses and workers that are needed to close. And more supports for these workers. If paid sick days aren't an option, then wage replenishment for those that test positive, time limited for the duration of the pandemic and easily accessible. Also, protections for temporary, contract, and agency workers, as well as continuing outreach to help them access existing supports, training, and personal protective equipment to keep themselves safe. And please, continue self-isolating if you are sick. If you cannot self-isolate at home safely, call 905-281-1269. I repeat, 905-281-1269 to be assessed for referral to eligible free hotel quality isolation at one of our voluntary self-isolation sites in Mississauga and now also open in the city of Brampton. Together, all of this will continue to bring levels down here in Peel and give our immunization program the best shot to succeed. This past weekend, we saw a milestone: the completion of first dose immunizations for all consenting long-term care and high-risk retirement home residents in our region. This is good news and a step in the right direction. As we work with our hospital partners through the announced delays of the Pfizer vaccine, clear prioritization of who in Peel gets vaccine and when they get it is vitally important. And let me be clear. While all of us, especially in public health, want to start immunizing widely and quickly, We have only just enough supply for provincially identified high-risk populations at this time. For the next few months, there unfortunately won't be vaccine enough for everyone at the same time, so we will continue to direct limited supplies to vaccinate our most vulnerable and those that care for them. We know these groups face the greatest risk. It's the right and ethical thing to do. Having also been heavily hit with COVID-19, I believe we must also deploy as many vaccines as possible, including those we have received thus far within the community here in Peel. And all of us must continue to stay the course, stay home, self-isolate if sick, and support our most vulnerable. Patience is our weapon, and we will get through this together. Thank you, and I'll pass it back to Mayor Brown.
Thank you, Dr. Lowe, for your update. And on that note, happy to take questions. First up is Shauna Hunt from City News. Shauna,
Hi, Mayor. I want to start with vaccines. I'm wondering how many doses is Peel Region asking for, and are you worried that you just won't get it because of the Pfizer shortage?
So I'll have Dr. Lowe speak to that. We understand right now that there's a major supply challenge in Canada, and I hope the federal government addresses that quickly in their procurement. It's unfortunate that Canada is so far behind many other countries in terms of procuring the vaccine. But what we have articulated, the mayors in Peel Region and the Peel Region chair, is that for the supply we do get, there's no reason it should be going to regions in the province that have less stress on the ICU, that have a lower positivity rate and a smaller population. There needs to be more common sense when it comes to where the limited supply we have is actually allocated. But I'll have Dr. Lowe speak to how the Pfizer shipment changes affect Peel Region.
Yes, thank you, Mayor Brown, and thank you, Shauna, for the question. Certainly with the vaccine supply and allocation, this is directed by the Ministry of Health. Certainly in the region of Peel, we continue to work with our Ministry of Health partners and would welcome any and all vaccine supply with the recognition that the national shortage that will be caused by the Pfizer vaccine will pose difficulties and challenges, and also recognizing that there are areas in Ontario that have yet to see vaccine for some of their most vulnerable residents. So certainly navigating all of these different considerations, I think our mayors and certainly ourselves in the Public Health Department here would make the case, however, that more vaccines would certainly be welcome in the region of Peel, recognizing that our frontline workers, our hospital workers, our healthcare system, and particularly the significant numbers of patients that are being treated, as well as the risk that is material to our senior populations, et cetera, should be considered in any distribution allocation. Thanks for the question.
Okay, Shauna, is there a follow-up question?
Yeah, I want to touch on sick days too. I know that you continue to advocate for them, but what is the next step in the battle for paid sick leave? I mean, you can only ask so many times. So what are the next steps in achieving this?
Well, I believe a conversation needs to happen between the provincial and federal governments. I had a good conversation this weekend with Ontario's Finance Minister, Peter Bethlenfalvy, to make sure he was aware of some of the shortfalls in the Canadian Recovery sickness benefit. I think a lot of people don't know that, I hear the provincial officials saying, oh, there's a federal benefit, and the federal government saying, oh, this is a provincial service. So we see a lot of finger pointing. The reality is there are not provincial benefits to protect our workers who are going to work every day, even during the lockdown, because they're essential workers. They're going into work sick. And the federal benefit takes 3 to 4 months to get back and is below minimum wage. And so it's not a realistic option. And so what it comes down to is this is a huge gap in our COVID response. And so I hope that Prime Minister Trudeau, Premier Ford can work together in a creative and collaborative fashion to fix existing mechanisms. And I know that the provincial government doesn't want to create a permanent benefit, but they could have a temporary enhancement during COVID. And it comes down to this. Look where the transmission is happening. The transmission is happening in these industrial settings, and then it leads to household spread. And if we're going to ask these essential workers to go to work, knowing that there's a greater risk, knowing that we're in the thick of it right now, the very least we can do is have their back with paid sick days. And so it makes me scratch my head that it's taking so long, but a number of the advances that we've had during COVID-19 have taken time, have taken persistence, have taken campaigning. I look at the Safe Restart Agreement that helped with frontline municipal workers, transit operators, paramedics, public health workers. It took 3 or 4 months of lobbying from mayors and those in the media before that agreement became a reality. And so I hope that we are getting closer to changing minds on the file of paid sick days, and we're going to continue to petition the government to do so. Our next question is Graham Frist from the Brampton Guardian.
Good morning, Mr. Mayor. How's it going?
Good.
My first question would be for Dr. Lowe. I'm just curious. You mentioned that the long-term care home vaccinations were completed. Was that 1 dose or 2? And if it was only 1 dose, when do you guys expect the second dose to be completed?
Thanks, Graham, for the question. Actually, it helps me to clarify the supply issues that we have within the community at this time. It is the first dose that has been given to all consenting long-term care and high-risk retirement home residents at this point in time. In general, the minimum spacing between doses for the Pfizer product is 21 days, and the minimum spacing for the Moderna product that we are using in these long-term care homes is 28 days. Notice I say minimum because it doesn't have to be given exactly at that time. The National Advisory Committee of Immunization has said that it can be extended up to 42 days after the first dose, at least on the basis of data we have, and possibly longer, just knowing how vaccines work and how immune reactions are boosted. But all that to say, the second dose will be coming within the next few weeks in accordance with the identified minimum spacing. But it also means that with the current slowdown and with the current Moderna allocations that we do have, pretty much all of our second doses and all the incoming supply is spoken for that population to ensure they get their second dose. Thanks, Graham.
My second question would also be for Dr. Lowe. The UK variant, how many cases of the UK variant are in Peel Region right now or have been identified in Peel Region? And what's the latest research saying on what the efficacy of these vaccines on that UK variant?
Thanks so much for the question, Graham. At this time, we've now started tracking things more broadly across the province. I believe Dr. Yaffe said there's 23 across the UK of the UK variant across the province. I know in Peel we had 1 case. Previously, there certainly may be more, and I do know that our lab partners continue to sequence to identify. At this time, there is no indication that it is less effective. The vaccine is less effective against the UK variant, as well as the one that was identified in South Africa. And there is still research that's ongoing examining the variant that has been identified in Brazil to determine if there's any concern there. Either way, it really speaks to the need for us to continue to stay at home, to adhere to the measures to limit and control spread so that the variants can't propagate further. Thanks for the question, Graham.
Okay, our next question is Steve from in Brampton.
Hi, this question is for the mayor.
Yes.
And the question is, the GTHA mayors floated the idea of provincial government temporarily mandating employers to pay sick benefits and then ultimately the federal government paying them back. My question is, why should this burden be placed on the taxpayers when these employers are the ones who are benefiting by these sick people working?
So if you look at the countries that have had successful COVID-19 responses, paid sick days have been one of those tools. And if these companies are so critical to Canada's supply chain, that tends to be the transportation logistics companies, the food processing, we need to make sure we have proper supports for the workers that go in there. We know where the outbreaks are happening. We know where the transmission is happening. And obviously, there are people going into work sick, and we need to address that. It can't be a patchwork of some companies that are financially successful providing paid sick days on their own, and there are some large companies that do that. Amazon, for example, has the financial ability to do that, but there are many companies that are already on the brink that can't afford to do that. And so rather than have a patchwork system where only a few successful companies are able to provide paid sick days, I want to see it across the board. I want to make sure that our vulnerable essential workers actually have that ability if they get sick, because it's only going to cost society more if we continue to have a COVID pandemic that is out of control. And so I really hope this tool comes as quickly as possible, and it can't be the current mechanism where an employee will have to wait 4 months to get that benefit back because they won't use it if that's the case. When you're living paycheck to paycheck, you have to put food on the table and pay your rent. You cannot wait 4 months. And so the system is broken right now, and it needs to be fixed.
And my follow-up, I guess anybody can answer if you'd like. York Region has announced that they're going to be announcing the big box stores that are being fined for violating the rules, and Toronto has announced also. What's the plan for appeal?
So I believe that there was, as part of the blitz, there was a lunchroom violation. There were some minor violations that were found in Brampton, but I'll have Paul Morrison, our Director of Bylaw Enforcement, share with you the violations that were discovered during the big box blitz.
Thank you, Mr. Mayor. We did have the ministry come in and do the big box blitz on the weekend. This is the second time we've had them in the city of Brampton, and they found what we traditionally find is use of the masks is not proper. People pull them down below the noses. There's been some violations in the lunchrooms where there hasn't been a separation of people of 6 feet or greater when they're eating their lunch. There's been a few violations at the front doors where the lines sort of tend to bunch up a little bit more than they should. We've also looked at violations including not having a proper safety plan within the store environment, as well as not having some PPE and other protection devices such as plexiglass separating the cashier and the customer. So these have been traditional over the past 2, 3, 4 months, and it isn't extraordinary to anything we don't find normally in our enforcement activities in the city of Brampton.
Okay, our next question is Nitin Chopra from Prime Asia TV.
Good morning, Mayor. My first question is to Dr. Lowe. Dr. Lowe, this is in regard to the second dose of the vaccine. Manufacturers clearly they recommended that for Pfizer it's 21 days, as you mentioned, and for Moderna it's 28 days. Health officials says delay up to 40 days are okay. When we talk to some of the doctors and emergency physicians, they said it is not okay. Delaying the vaccine of second dose is not okay. Delay for 2-3 days or 1 week is okay, but 42 days is not okay. That is the statement of the health officials. People are very confused because some scientists also said that delaying the vaccine to larger extent may lead to viral mutation and inadequate immunity. Being a health professional, being the chief of PL, what you wanna say in this?
Yes, thanks for the question, Nitin. The National Advisory Committee on Immunization is very clear, and they've reviewed all the data that has been provided to them by the manufacturers through the trials, and they have stated that while it is ideal to try to adhere to the manufacturer's recommended schedule, that doses on the basis of the data that they have received can be extended to 42 days as needed. The important thing to remember is that in immunizations, ultimately, the days that are specified are a minimum spacing. The idea is that you get your first dose and you get the immune reaction with it, and then you actually try to boost it with a second reaction afterwards. So the idea is you actually don't want to give it earlier than the minimum spacing because the second dose would then be ineffective because the first dose is still having its effect. But after the initial immune response has occurred, you can give a vaccine, ideally at the time that it was studied for, but presumably any additional boosting or immune reaction will provide that additional protection. And it's for that reason, for example, if you look at other vaccines, the measles, mumps, and rubella vaccine is meant to be given at 12 months, but then again at 4 to 6 years, right? So they actually give a 2-year window on a minimum spacing. In that instance, of course, the Ontario schedule has it at 18 months, but the long story short is when it comes down to the vaccination schedule, these are minimum spacings and on the basis of ideal data for recommendations. But certainly we're in a limited supply situation, and if there is extension that needs to happen, which we're not planning for at this point in time, we are reserving second doses for our long-term care residents. We will make sure that that is happening in accordance with federal guidelines. Thank you.
My follow-up is for Paul Morrison. My question is, what challenges are you facing for implementing the stay-at-home orders here in Brampton or in Peel?
Good question. Thanks, Nitin. Our first challenge is the fact that people aren't adhering to them in all cases. We have a great percentage of our population that are staying at home, that are respecting the fact that they don't want infect other people, they don't go out. But there are still some people that feel that it's their right, or they are not going to catch the virus, that are going out. They're not staying at home. They're inviting too many people over. But one of the things that we did notice is we have a lot more people calling us and asking us for clarification, and they're very much interested in learning how they can really comply to those regulations. So we appreciate that.
Okay, Nitin, thank you for your question. Our next question is Nida from the Pointer.
Hi there. Good morning. Mayor Brown, my questions are for you. In Council's 2019 Statement of Expenses, under your personal expenses, there's $44,000 listed under external legal expenses. So I understand this is something that's available to all of Council and not just you. But can you explain the specific legal support this money was used for in your?
Yeah, I don't believe that's a mayor's office expense. You can speak to the city communications department about that. Invariably, there are legal issues that council request opinions on or advice on, and I'm sure they'd be happy to clarify.
Thank you. That is the mayor's office expense, actually listed under your name, Patrick Brown. Is this money used in any way in relation to the lawsuit brought?
So you cut out there.
Sorry, I'll repeat my question. So this expense is listed under your office. It's actually listed next to your own name. So I want to ask, what is the lawsuit brought on by Vic Fidelity?
Yeah, so your question was cut out. I think I heard, was that in relation to a lawsuit to do with Vic Fidelity? No, that's not.
Yes.
No. But thank you for the question. And that completes our questions for today and our COVID-19 update. Everyone, please stay safe, stay healthy, and we look forward to giving you an update next week. Until then, thank you so much.